We are implementing a program called Making It Happen. This program is funded by UK Aid through DFID Kenya. So the aim of this program is we are contributing to the reduction of maternal deaths and newborn deaths. And we are doing this through increasing availability and quality of skilled birth attendants and also emergency obstetric and newborn care.
I could not confidently handle a mother with the PPH, postpartum hemorrhage. That I couldn't confidently handle. So I most likely used to call the doctor. I would even talk about neonatal resuscitation, Yeah, I would not confidently resuscitate a baby on my own. I had to have somebody on board to actually help me resuscitate a newborn. There are skills I couldn't do on my own, like assisted vaginal delivery.
So that is where the training comes in, as an adjunct to this medical training that people have had to correct any gaps that they may be there in the training and also deficiencies during the practice itself. So it's a skills and training course that is majorly aimed at equipping participants with the skills needed to provide this emergency care to the mothers, that's the maternal bit, and the newborns, the neonatal care. So it mainly focuses on the known conditions that are known to cause the biggest burden of mortality and morbidity, both for the mother and for the baby. So we can look at quickly tomorrow's timetable. The first lecture of the day will be assisted vaginal delivery. A day before the training actually starts, we have a meeting with all members of the faculty. We do what we call a skills run-through, so that we give a standard presentation to the participants and we don't have sort of a conflict that they're told one thing in one area. When they move to the second station, the facilitator has a different idea.
We want to look at vacuum delivery or assisted vaginal delivery.
This course is a Ministry of Health course. We have worked together to revise the various documents that were used in this country before and come up with one document or curriculum that has been agreed upon by Ministry of Health and the stakeholders in maternal and newborn health. So the curriculum we are implementing is a national curriculum, which LSTM really contributed heavily to. When we get the doctors, the nurses, all those healthcare providers on the training, the first thing we do is to give them a pre-test.
So we were given the pre-skills assessment, and a big surprise to me, actually I wasn't able to do most of the skills, and I just realized that I didn't have the skills. Yeah, my confidence levels was low because I couldn't handle the emergencies on my own.
Then there are two things I can do at this point. I can simply stick my hand and deliver the posterior arm, or in love sets, they normally say you can.
It's been very intense, it's been very engaging. We've had different activities, they've used different teaching aids. The training sessions are highly interactive from the word go. We have videos sometimes, we go to stations and rotate to practice different skills.
Posterior? Where is the posterior fontanelle facing? Really? Try once more.
And I went a master's trainer's course in Nairobi. So what happened is that when I was posted to that facility, we came in with the new nurses who had never undergone any EmONC training. So what I did, I stayed with them in maternity when they were doing their deliveries, when they were having any emergencies, actually stayed with them and mentored them on how to do most of these emergencies. Number two, LSTM has also supported a mentorship program on EmONC in our county. So we do it after every 3 months. They've selected facilities in our county where we go around as a master trainers, and we mentor most of the midwives in the facility.
Supportive supervision involves a team of master trainers, so to speak, who go now directly into the field, into the various hospitals, health facilities, and into the wards, where we now interact with the people we have trained. We see what they are doing, we assess, we hear from them the feedback, their stories. We look at the indicators, we do look at the data down at the hospital to see if there have been any improvements. And also, where there are any gaps, we are able to interact with them and guide them.
Confirm again.
The training was very beneficial to me because I have changed from the person I was before the training began to right now. I feel like a more confident clinician and one who can be able to lead a team or be part of a team with more skill and more confidence. I feel basically equipped to be able to handle any obstetric emergency, something that I didn't have before the training began.
In my facility, we only have one doctor who needs to go to the other wards to manage the client. So it has even made work easier for the doctor. Because before then, he has to be labeled throughout, and sometimes he would not be able to attend to the other clients. But currently, he just pops in and maybe just see 1 or 2 cases. But most of the cases, I'm able to manage myself with the midwives in maternity.
As we speak, this training is in the guidelines for Ministry of Health. It is in the curriculum for Ministry of Health. We have implemented it in 47 counties. Every county has a training equipment, a full training equipment for EmONC. The only thing that we really need to strengthen now here and really strongly advocate for is for the counties to include this training in their work plan and have it funded so that any new staff can be trained.
As a government, to ensure that the EmONC skills are embedded in the healthcare worker, we're introducing the pre-service training where the humanistic models are put in skills labs in our universities and our medical training colleges so that the graduates are equipped with skills to handle emergencies during maternity and during the newborn period.
So that's a very good step on sustainability, because if you're starting right at the point of syllabus and curriculum and making sure that this is integrated in their training, it means that every midwife, nurse, medical doctor who graduates already has it.
So what you do, you are holding the shoulders here anteriorly and posteriorly here, then you rotate 180 degrees. So
we had a reduction in referrals. We no longer refer unnecessarily. Like those days when we used to refer most of the mothers because of emergencies.
If every hospital, every health center is doing that, then overall, we do have the number of maternal deaths drastically reduced, number of babies dying drastically reduced, number of patients facing severe complications and the like saved. So overall, the health indicators are seen to improve. And even here, we have seen it. We have seen a decline in the maternal mortality ratios, a decline in the under 5 mortalities, directly as a consequence of the impact of this course.